I am so glad this evening to be joined by Lindsey Lind. Lindsey and I are together in the Partners in Policy Making class, which is a leadership program through the Tennessee Council on Developmental Disabilities. Welcome to the Raising Kellan podcast, Lindsey.
Thank you for having me. I'm excited to be here tonight.
Lindsey, so
Yes.
that listeners have a better understanding about your background and who you are, would you mind giving us a little bit of that background information?
Sure. So I'm a mom of three kids. I have an 11-year-old son, a 10-year-old daughter, and a 7-year-old boy. And my 7-year-old was born with an extra male chromosome. So he has what is actually called 47XYY. And he also has autism and ADHD. And basically, my background is, I was a working mom. I worked in the corporate world. And I have an accounting degree and I have my master's in accounting, but I had to step out of the workforce because of the high needs of my youngest son. And that just opened my eyes to a world I didn't know existed, which is the world of disability. And, with dealing with the school systems and the doctors and all the therapy appointments, like nothing I ever knew existed until I had a child with disability, right? So, yeah, that's kind of where we're at right now.
Okay. Lindsey, you've also taken
Mhm,
your skills and you've
mhm.
translated it in another way. Can you talk more to that, please?
Sure. So basically, my background in accounting, I started in public accounting as an auditor. And so com coming through the auditing background, are looking at policies and procedures and all these kind of things. And even though I stepped out of the workforce, I still follow and read all the policies, rules, and procedures because when you're dealing with a school system with a child with disability, it's very important that you navigate it by reading the policies and procedures that schools are supposed to follow and all the laws that are applicable for students with disabilities and the accommodations and services the schools are supposed to provide to children that have these disabilities. And so, with that being said, that's also how I've became into advocacy, correct? So, like, as I'm reading all these laws, policies, and procedures, and I'm hearing from other parents, like their experience of disability with school systems, I just start researching, right? And I start reading, like, what is IDEA? What is 504? What's an IEP? Like, what are all these different things and how they not only apply to my child, but other parents as they were approaching me and saying, like, my child is struggling with this. Like, how do I approach the school system with this? And I'm like, oh, well, do you know that there's, all these resource guides out there, especially in the state of Tennessee with the Tennessee Department of Education that are out there for parents to access and read and educate themselves on and what the school is supposed to be doing and providing for that child, right? If you have a learning disability or a disability in general. So I've been able to apply the skills I learned through auditing to the world of disability. It's just a little bit different of a procedure, right? So, and with that, like I still do my accounting. Like I am in two non-for-profit groups. I'm on the board for, I'm a treasurer for AXYS or Access and Inkstrom Services. And yeah, I just continue my accounting through them and obviously now advocacy work as well, right?
Tell us more about Access because that could be a potential resource for parents listening, Lindsey.
Yes, so Access is a non-for-profit organization that was created, and we help families or people that are diagnosed with sex chromosome variations. Like I said, my son has 47XYY. He was born with the extra male chromosome. And a lot of times, how we found my son's condition, we didn't know. A lot of times, you can find out through birth, right? Like through prenatal testing screenings, But for us, we didn't find out until he was 5 because he kept having a lot of behavioral problems. He was having, we thought he had sensory processing disorder, seizures. Like we were going through the list of things we were seeing, we were struggling with. And finally, his neurologist was like, "Did you get him genetically tested? Because I feel like there's something underlying going on that we're missing." And so we did the genetic test, and that's how we found the extra chromosome at the age of 5. And so Access was actually presented to me, and they have a ton of resources for parents and people that have an extra chromosome variation. They actually have a school guide to help assist your school on how to help children with extra chromosome variations. Within the school system, they have resources to doctors and books and all kinds of things, and they provide stipends for families to travel to see the doctors that actually have worked with kids and children or people with the chromosome variation, because a lot of times what we have found living in East Tennessee, like doctors will tell me all the time, "Well, I've heard of this condition in med school, but I've never actually worked with someone who has this condition." So we kind of have to travel and go see specialists that understand and know how to work with someone with this condition. Yeah.
Through
Sorry.
partners in policy making, in just for full transparency, we often meet on Zoom and we talk virtually. And a point that has come up recently are the changes that are happening at a federal level, or proposed changes rather at a federal level, and how that potentially could impact both healthcare in terms of Medicaid, as well as education in terms of protections offered by the 504 and IDEA. What are your thoughts on that, Lindsey? I know you are a strong advocate as far as it comes to the educational realm and making sure Gavin receives the supports he needs. So, what's keeping you up at night right now?
Yes, I mean, right now it's the lawsuit with the 17 states that have filed, and it's, the Texas versus Becerra lawsuit that actually goes to court on February 25th. So in 2 days, it's really keeping me up because this is the 504 that you're mentioning, and a lot of people don't understand. So it was first filed in September of 2024. And it was basically the states were saying they were trying to get rid of what the Biden administration had added the verbiage to the 504 Disability Act, meaning the verbiage that they were speaking of is the transgender, right? So, and when you read the 40-page lawsuit, the first 36 pages in the verbiage, it is the specific verbiage that they were wanting to remove from the Biden administration. I do agree with that 100%. But then starting on page 37 of this lawsuit is when they ask for the entire section of 504 in its entirety to be found unconstitutional. And that is what is keeping a lot of us up at night and calling our state attorney generals that are in this lawsuit to withdraw themselves from it, because to remove the entire section 504 is completely removing, the discrimination rights that are there to prevent, them to discriminate against kids with disabilities. It would take away the services and accommodations that are there to help kids with disabilities be successful in the school system. And they want to completely remove that. And they're hiding it behind, "Oh no, we're really just trying to get rid of this verbiage from the Biden administration." But it's not, if you read the entire lawsuit. And
And what
that's what is really keeping me up at night,
and and what Lindsey is talking about here is like the free, appropriate public education that is offered to children with disabilities under 504 of the 1973 Rehabilitation Act. It's also what ensures supports for our children in the least restrictive environment. Um, so, where, and I don't know whether this is a fair question to ask Lindsey,
Mhm.
but where do you kind of seeing this going from here, or what do you think
Right.
parents need to be vigilant about? Well, right now, obviously, if you are in one of those 17 states, you need to make your
Yes.
voice known by contacting the AG, the Attorney General of the state. But
Mhm.
what can we do to advocate or to be more vigilant of this current situation?
I mean, I think parents just need to understand. Like, I believe I sent you the Newsweek article that was written by, the ARC of the United States CEO, Katie Neese. And she was saying, in 1971, before federal protections for people with disabilities existed, states were free to exclude children with disabilities from their public schools. And that's exactly what this 504 lawsuit is trying to do, right? Because if you exclude these children, their services and their accommodations that help them thrive in a least restrictive environment, like you're saying, by having these 504 services and accommodations available to them, if we take those away, those kids will not be included in a public education setting because the school will not be able to support them. So in order to advocate for this, you need to call the state attorney general. You need to send emails. You can email, phone calls, they're free, right? It doesn't cost anything. And continue to call them and tell them the withdrawal from this lawsuit. But I think the thing that's very disheartening is some of these attorney generals are stating like, oh, we're not in that lawsuit anymore. We withdrew. They did not. There was actually an update on this on February 19th by the Disability Rights Education and Defense Fund. They posted it on their website. There's actually a letter for the update on where the status of this lawsuit is. And they said that the filing does not change anything about the case. Like the states did not make any changes to the complaint. And no states have withdrawn as of February 19th.
And so, to give folks an idea, the 17 states that we're talking about are Alabama, Alaska, Arkansas, Florida, Georgia, Indiana, Iowa, Kansas, Louisiana, Missouri, Montana, Nebraska, South Carolina, South Dakota, Texas, Utah, and West Virginia. Yeah.
Yes. So correct. And I know Tennessee, we're based in Tennessee, right? And I know Tennessee is not listed. And people are like, oh, but Tennessee's not there. Well, you have to understand, Tennessee has been a very difficult state to navigate the education system with. I fought for my child as hard as I possibly could. And, was saying like, you're not following this policy, you're not following this state law, like you're not doing these things. And it's very, very hard unless you know the laws and you know the services and the accommodations your child is supposed to be receiving, like they are not going to provide it, right? So it's very important for parents to understand, like you need to learn your rights and know what is available and what they should be providing because the school's not going to be upfront with that information with you to begin with, correct? So that's where I'm up a lot at night, like worried about this case, because yes, it goes to court in 2 days. And if this gets approved and the Department of Education gets dismantled, like Trump has stated he's wanting to do, if, as he's already been doing it, because the biggest issue is like with the 504, that's through the federal government, correct?
Right.
And the only way parents can hold states accountable for not, giving them the service and accommodations that their child received was through the Office of Civil Rights at the federal level. But with the Department of Education being dismantled, and we're not really sure where the status of the Office of Civil Rights stands right now because they are cutting some of the funding to the Office of Civil Rights They're not even receiving any current complaints right now, and any complaints the Office of Civil Rights did have prior to Trump coming into office has been put on hold status for right now. It's very difficult to see the 504 and where this lawsuit goes and if it gets passed, because with the Office of Civil Rights being put on hold right now, like where do parents go if they need help or assistance?
Lindsay, let me ask you this. In terms of resources or uh, kind of calls to action for parents to be, as I said, like vigilant. I know we have the Tennessee Disability Day on the Hill coming up on March the 12th, and that might honestly be just one way to participate, to make your voice heard to your legislators here in Tennessee, advocating for the need for our kids to have those supports in in the public school setting. As you know, Tennessee has gone on to a voucher system as well.
Yes.
And that kind of opens up a whole different scenario right there. But but um, definitely advocate for, continuing for our kids to receive those supports in a school setting is going to be vital. I mean, not just
Mhm.
for our kids. I'm talking about kids with disabilities, period.
Well, I'll even say this. So my son obviously has high needs and he's on an IEP, but my daughter, for instance, she has ADHD. She's on a 504, right? And a 504 is more for accommodations, not services. So when I say accommodations, what people may not understand is if you need extra time to take a test, right? Because sometimes your child may have a hard time focusing, right? ADHD, hello.
Right.
um, that's extra time to take a test. If your child gets anxiety around test time, a 504 would give them accommodations to help give them a support of getting extra time to take a test. Sometimes it gives them extra accommodations to have a fidget in the class, like so they can keep their focus and not be super disrupted to the classroom, or gives them extra breaks, or they can have calm down room time. Like these are accommodations we're talking about. It's nothing that is like extravagant, like extravagant cost to the school.
Right.
It's just giving somebody a little bit extra time or assistance that they may need to help be able to keep their focus a little bit longer. Like that's what some of these accommodations are, and that should be provided. But when you take those rights away from these kids, like you're kind of setting them up for failure.
Failure.
Yeah.
Um, it's definitely a heavy topic, and you know what? I think it's keeping us all up at night, to be quite frank. And um, I think it's definitely a topic we need to come back to as well, Lindsay. Um, in closing, are there any other resources or are there any upcoming events that you want to make listeners aware of? Um, if you don't mind heading into
Yeah,
that. Yeah.
sure. I mean, I know you mentioned Disability Day on the Hill. That's coming up in March. Like, that's amazing. And actually, one event I forgot to mention is the Chattanooga Autism Walk is
Okay.
coming up in April. Like, I'm going to be there. Like, my family, we have a team, and I'm going to have a booth for my non-for-profit for AXYS. I'll be there promoting AXYS at that event. There's actually the Tennessee mega conference, disability mega conference, that is put on by the Tennessee Art Foundation. And that is going to occur in Nashville in May. I will also be at that event promoting Access, of course, but I'll be there. And then Access is actually having a big conference at the Emory Center down in Atlanta in July. So we are excited to be promoting an in-person conference, because the last time we had one, it was in 2019. So it was before COVID. So we were ready to have another in-person conference again. So yeah, there's a lot of events coming up with lots of useful resources and services like to connect families that may be experiencing, or caring for someone with a disability, or if you have a disability, like these would all be great events to come to and make connections. Yeah.
Lindsay, thank you so much for your time this evening. It was an absolute pleasure.
Yes.
And see you next month on on Zoom.
I know. And then, yeah, if you want to get together and talk again, it might be great to see what happens after in the next 2 days, because that's going to determine a lot,
Yes, it
right?
is. Yes,
Yeah.
it is. Well,
So, yeah.
listen, you have a great evening and speak to you soon.
Okay. Thank you. Have a great night.
You too, Lindsay.